Hi everyone. So let's take a look at this very last section of chapter 22, which is section 9. This is looking at immunologic memory and immunity. So don't get too excited. There's still a couple of videos after this. We're going to go over some clinical views, hypersensitivities, and HIV. So just hold off on that excitement there. For this one, we're going to be taking a look at memory. We're going to be taking a look at what happens when you're first exposed to a pathogen and how it's different with a second exposure. And then we're going to take a look at a couple of types of humoral immunity that we are going to acquire, I guess, yeah, that's an appropriate word, acquire through in our body. So let's first start with this memory that we are going to have. We have memory because of those memory cells that are going to differentiate. So if you remember back in that animation, whenever T cells and B cells differentiated, one of the cells that is formed are memory cells. And that's what's going to be so important here. And one thing that sets adaptive immunity apart from innate immunity is that memory that is going to be there. So the memory results from the formation of those long-lived army of lymphocytes upon immune activation. I like that little term there, long-lived army. So we're going to be taking a look at how there's always a little bit of a lag time. Between that first time that you're exposed and direct contact, you're going to have this little lag time before you have the whole action that's going to take place. So once activation, or not, I guess I shouldn't say action, but activation takes place. So once activation takes place, it leads to formation of those memory cells. So let's go ahead and look at what happens with subsequent exposures. You get those memory cells and they come into contact with the antigen, so they're able to respond a lot faster, and usually it's a more powerful response. That's another great thing about this kind of secondary or subsequent antigen exposure or secondary immune response that we are going to have. So the pathogen with a secondary response, the pathogen is typically eliminated before the disease will even show any kind of symptoms, before that pathogen will give us any kind of symptoms. And we'll talk about vaccinations here in a second, and how vaccinations are really good because they help lead, they are very effective in developing memory without us really being exposed and hopefully not getting sick from a pathogen. So we'll take a look at that here in a second. Here's definition of antibody titer, but we'll look at that right here. Let's identify it here. So what we're looking at on the graph is days from first exposure to antigen, and it's comparing it, it's looking over here at serum antibody titers, and this is basically going to be how much circulating antibodies do we have. So that's what it's going in and referring to, circulating blood concentration of antibody against specific pathogen. So this is looking at primary response, the initial exposure, the first time that you're ever exposed to this pathogen. So it can be you're naturally exposed to it, somebody sneezes on you, your kid licks your face, something like that, or you're exposed to it through a vaccination. This is the initial exposure. This is what happens here. So with primary response, here's this lag time. Again, we always are going to have this kind of lag time, which is the initial period of no detectable antibodies first. It's 3 to 6 days. And what's happening in this lag time is the pathogen is going to eventually get to the lymph node. That's where the antigen is going to be detected by a T cell, B cell. It's going to be activated. That cell is going to be activated. The lymphocyte's going to be activated, I guess I should say. It's going to proliferate and it's going to differentiate. So it takes a little bit of time for the antibodies to actually go in and being made. So that's the lag time, is when you don't have any kind of detectable antibodies. This is also the time when you're getting sick, right? Yeah, you're always going to, with first exposure, you're typically going to show some kind of signs and symptoms of what you're sick from. And again, it just depends on the pathogen, right? You'll learn all that in microbiology. So look at what happens within what is it about? It says 3 to 6 days. First ones are going to be the IgMs that are going to be first produced. And then a little bit later on, you're going to have IgGs. A little bit more potent, or not, I guess I shouldn't say potent. A little bit more IgGs are going to be produced after that. So plasma cells are producing these IgMs and then the IgGs within 1 to 2 weeks. And they don't peak very high, but this is enough to go in and fight off that pathogen, and you're going to recover after that. Let's go ahead and take a look at subsequent exposures. This is our secondary response. Secondary response is when you are exposed to the same exact pathogen again. And when I say same exact pathogen, it has to be the same exact strain of the flu virus, the same exact strain of this cold virus. Because I know you're thinking, well, you know, I feel like I've had the cold several times, and you're saying that I'm not going to get, you know, show signs and symptoms. Remember, there's so many different strains of all of these different pathogens. That's why we tend to get, we can get sick multiple times from a cold, with a cold. But secondary response, the net exposure occurs after varying lengths of time. But look at that lag time, very short lag time, because of the fact that these cells don't have to undergo all of this. Those memory cells are already there. It's like, no, I remember you from last time, so it doesn't have to go through all of this. It's already there, and it's going to start to just kick out as many antibodies as possible. Look at that. Within just a couple of days here. I guess if we look technically, it's what, about 5 days when you're at your peak antibody exposure. But this can vary as well. And it's usually going to be those IgGs that are going to have the biggest response, that you're going to have the most of. So yeah, that's why you typically don't show any kind of sickness, that you sometimes you don't even realize that you've been exposed to that pathogen naturally. Now with vaccinations, you know you're exposed to the vaccination, right? Because they're going in and injecting you. Hopefully you don't get sick from it. Some people can have side effects where they do show sickness from a vaccination, but for the most part you don't. So that's because of the fact that it's going in and making antibodies. And we'll also talk about how vaccinations are a weakened or dead pathogen that they're giving you. So they're not going to be very virulent because of that. So that's why you don't typically get sick after vaccinations, unless you have a weakened immune system, which you shouldn't be getting your vaccinations anyway if you have a weakened immune system because of that. Just get them whenever you're healthy, right? So I was thinking, I wanted to say something else, but now I can't remember after that. Okay. So let's go ahead and take a look at these types of humoral immunity that we have. And why I keep mentioning that these are humoral immunities, we're still on this idea of antibodies. And remember, always link humoral immunity to antibodies. That's the main thing that they are going to, that's the main effect that they are going to have, is the fact that they produce antibodies. So there's an active immunity and a passive humoral immunity. And active is going to result from when you have a direct encounter with a pathogen. It can be naturally or artificially. And the body has to go through that whole process of activation, proliferation, differentiation, and the action of the B cell going in and making the plasma cells, and then those plasma cells secreting antibodies. That's pretty active, right? Yeah, the body's going through the whole process to make antibodies. And what the great thing about active immunity is, because you're going through that process, memory cells are going to be made. That's the great thing about that. You also have a passive immunity. Passive immunity is going to be where you obtain already made antibodies from another individual. Again, it can be naturally or artificially. The bad thing about this is, because you're not being exposed to a pathogen, it doesn't go through that whole process. It doesn't go through differentiation to make memory cells, because you're just given antibodies, and no memories are produced because of that. No memory cells are produced because of it. So there's a few different types that we are going to have. So we're going to go through these different naturally acquired active immunity, We're going to go through this artificially acquired active immunity. And then we're going to take a look at naturally acquired passive immunity and artificially acquired passive immunity. I know this section, this nice little picture is not in your book. I want you guys to draw this out and write it down. So let's first take a look at a way that we can naturally acquire this active immunity. This is what we talked about in the last little section with memory. This is whenever you are being exposed naturally to a pathogen. Think about it. How are you naturally exposed to a pathogen? Someone sneezes on you. Again, your kid licks your face. Something like that. Some way you are getting a pathogen being exposed to you somehow. So that's environmentally exposed, I guess you can say. So it goes through the whole process of what I already talked about over and over again: activation, proliferation, differentiation, and then effects after that. Artificially acquired. Someone is injecting you with a pathogen. Now, who in the world would do that to you? It's your doctor, right? Yes. They are the ones that are going to go in and inject you with a weakened or a dead pathogen or microorganism. They're vaccinations, right? Absolutely. They are going in and exposing you to the antigen on that pathogen so your body can go through the whole active process. And again, the good thing about active, the good thing about these two is your body is making memory cells. So hopefully that's the whole point of vaccinations, right? Talk about it in a minute. Let's take a look at these. Passive. The passive immunity that's going to occur. So naturally acquired passive immunity. So remember, these are going to be where someone is giving you an antibody already made. You're not exposed to a pathogen. They are just giving you an already made antibody. Naturally acquired, this is going to be through breast milk or through placenta. So that is going to be how an individual naturally acquires it. So obviously this is going to be when we are young. This doesn't happen into adulthood. So I'm trying to think of, yeah, that's what's going to happen. So you're just getting the antibodies, which is great for a fetus, right? Which is also great for a newborn baby that is breastfeeding. They are getting antibodies from their mother to help them defend against any pathogens that they might come into contact with. They will still probably might get sick, right? Because it's not going to cover every single pathogen they're going to come into contact with. But it's a nice way for the immune system to have a little bit of protection, that fetus, or especially the newborn, to have some protection. Again, no memories made, but at least they get a little protection. This is one that probably not many people have come into contact with or has had happen to them before. You might be one of the few. It hasn't happened to me. But artificially acquired passive immunity. This is going to be when someone is injecting you or giving you artificial antibodies. So this is going to happen, let's say, with a pathogen maybe that your body has never even seen before, even knows about. So this is something like if you get bit by a venomous snake or a venomous spider, you have to get antivenom, right? That's what antivenom is. It's going in and giving you these antibodies against that venom to help kill it off. Also with gamma globulins, those are going to be given, like that's how they can treat Ebola. I know so it's a little bit different than what I was talking about with the snake venom and the spider venom, but people that have Ebola can sometimes be given an antibody to help fight it off. What else I'm trying to think of? Some autoimmune disorders can be treated with gamma globulins or immunoglobulins. So rabies is another one. That's the one I was trying to think of, was rabies. That's another thing. Whenever you have to go in for a series of shots with rabies, it's because they are going in and giving you these antibodies. Again, you're not going to have any memory, but hey, at least you're not going to die, right, from the spider bite or the snake bite or the rabies or anything like that. So hopefully just depends on how fast you can get there, right? So let's talk about vaccinations and how they are going to, again, we've talked about how they're weakened or dead microorganisms. And they stimulate the immune system to develop memory B cells, and that is going to be great for later exposure. That secondary response is going to be triggered. You're already protected after that. So a lot of them will provide you a lifelong immunity, but you might know that you do have to get booster shots, like tetanus. You have to go and get that every 10 years. So some of them you don't have to get. It's going to be lifelong memory. So some of these memory cells can live for decades, so that's kind of interesting there. All right, so the next video that you're going to watch is going to cover, even though, again, this might be the last section, you're also going to be taking a look at some clinical views. You're going to be taking a look at hypersensitivities. That's the next video. And then we'll finish off by looking at HIV. So until next time.